I came here in 2017. Dr. Steve Shirley hired me. A lot of you who watch this may have remembered Dr. Shirley. Still around when he's not lounging in the sun. He swings by. And I say that because I bought the practice from him in 2023. So started in 2017, went through kind of the process of learning how to be a good chiropractor. I had the foundations, but Dr. Shirley was really instrumental in teaching me how to manage patients, how to develop patient relationships, develop professional relationships within the community, and I'm extremely grateful for that. And then in 2023, we started talking, or actually in 2022 we started talking, and then 2023, March of 23, I officially purchased the clinic. People ask me a lot, why chiropractic care? Like I said before, I'd always been interested. PT sort of came as a natural option. I loved studying human health, human physiology. Biomechanics became a huge passion for me in my undergrad. But the thing that gets me the most is I like to solve problems, and I like people. And so I kind of put those together. I love interacting with my patients, and I love solving their problems of pain. That's what really gets me going. And so chiropractic is a way for me to put all those things together. My love of human physiology, my love for my community, and my desire to solve people's problems. Nothing makes me happier or more energized than when I figure out a solution to a sticky problem. And so that's really what gets me up every day in the morning. One of the questions is, probably see it on the screen, maybe right here, I don't know. What's the most impactful cases you've ever had? I think, man, there's quite a few. I'm trying to think of one that really kind of sticks out to me. There was one case that I think was quite difficult for me, but it did come down to problem solving, which is, well, let me back up a little bit. One of the things we pride ourselves here at this clinic is diagnostics. So we like to be really good at figuring out what the problem is. That's the number one step to helping people. And I had a patient come in, and we treat a lot of jaw problems, and she had really acute jaw pain. And we've had jaw pain. She's had jaw pain in the past. Anyway, I got to do my exam, did a little bit of jaw work, but my spidey senses were tingling. I wasn't really quite sure that this was a jaw. And she came in and she's just going, oh my gosh, my jaw, my face, it just hurts so bad here. And I'm looking at her and going, man, she looks a little bit like a chipmunk. She's got a little bit of swelling here. And so I pull out a tongue depressor, open your mouth, tap your teeth, work through. And I said, yeah, your tooth is sensitive. You have an abscess. Oh, no, my teeth don't hurt. Yeah, but you've got an abscess. I'm almost willing to bet. So I convinced her to go to the dentist. She was convinced she didn't need to, and got a message later on that day saying, I have an abscess and I need to get a crown and antibiotics, and I feel a lot better. And so that case kind of stood out to me because it made me remember to trust my instincts, and that figuring out the problem first is the most important thing that we can do. For people who haven't been to a chiropractor before, I think I'd like to answer that question by saying what makes us different. What makes Spinal and Sports Care Clinic different, what set it apart for its entirety of its existence, from Dr. Shirley starting it to where we are now, is the level of care and the level of diligence that we take to try to get to the actual problem. Going back to what I if you watch the other clip about the person with the TMJ pain, that's how I like us to be thought of, is we're careful, we're considerate, we're thoughtful. We put a high value and high priority on figuring out what the problem is. We're not a jump in, jump out, crack, see ya, 2-minute appointment sort of place. We try to do the very best that we can, and we're willing to use any tool that we need to get that done. And so if we need to refer to PT, we will do that. If we need to refer to neurosurgery, We know the best neurosurgeons in town. If we need to get you to acupuncture, great. If it's nutritional, fine. We'll find somebody. We're interested because we're results focused and because we're oriented towards our patients and our community. We don't really care what it takes to get you better. We just want to get you better. And of course, we have patients who are just kind of maintenance patients who come in for tune-ups here and there. But when we're talking active problems, we look to actively solve our problem, your problem, and we are committed to taking the care and the time that is needed to make that happen. And if we're not the people who can get you better, then we'll send you out. I send patients out all the time to people who are better at certain things than I am. For instance, I had a person with an unstable shoulder. I know that unstable shoulder needs work, it needs love, and it needs consistent high-level physical therapy. So I sent them over to U District. Shout out to U District. They're a great physical therapy group, and we work with them quite frequently.